Cosmetic physician in Hong Kong?
Actually, I'm a general practitioner with special interest in aesthetic medicine. So, but recent 10 years, my majority of the work is aesthetic medicine. So I basically not seeing any case of general practice anymore.
Right. Okay. So can you please take us through a little bit about what your practice entails?
My cosmetic practice basically cover all the cosmetic procedure except surgery. So I would do all the injectables such as botulinum toxin and filler, hyaluronic acid, radius, collagen stimulator, and also the new type of filler, and also the thread lift, including the Korean one or the European one, and also the energy-based device such as HIFU and Thermage, and also the laser-based device to tackle the skin problem, pigmentation, acne scar, and also the warts and the mold removal. And also I'll do body contouring, non-invasive one, using the cryolipolysis machine and also the monopolar RF machine to tighten up and to lose weight and to lose fat.
Wow, that's quite a wide range of treatments that you perform, Dr. May. May I ask, what is your favorite procedure, or what is the procedure that you perform the most in your practice?
My favorite procedure would be filler and the collagen stimulator injection. So injectable is my specialty. I love injectable and I'm quite good at it. And for filler and collagen stimulator, I like them because they have the instant effect and they can do a very life-changing effect for the clients. So I really like that.
You said that injectables, which includes fillers and botulinum toxin, is your specialty. Can you briefly take us through that what exactly filler and botulinum toxin is?
Actually, filler is like filling up of our sunken part. Because when we age, we do not age only superficially. Our skin age, so the structure underlying our skin is the subcutaneous fat, right? The fat tissue under the skin, also aging, also got aging, and then when it age, it lost its volume. So actually, filler is to replenish the loss of volume of our face. So many people don't understand the concept at the beginning, because when they age, usually they gain weight, right? Usually they will gain weight in the double chin, they will gain weight in the jaw, or they will gain weight on the body, like belly or the arms or the thighs. But actually, for the superficial fat pad is on the face, we have those superficial fat pad. Those are the fat layer that will lose volume. So when we lost volume, we have sunkenness on the forehead and the temple and the mid cheek and the lateral cheek and the tear trough and the nasolabial fold, all will sunken, and then it lost the support. When they lost support, the skin will start sagging. So we will start to have the skin fold over here, nasolabial fold, or the jaw, or the drooping of the eyelid, all because of the loss of volume. So filler basically is to turn the clock back to when we have the many chubby fat on the face, and when we have a more youthful and lift up face. So filler have this effect, but toxin is another concept. Botulinum toxin is actually a kind of protein that block the message from the nerve to the muscle, right? So when we have emotion, we have, for example, when we angry, we frown. Yeah, when we are surprised, we raise up our eyebrow. So for the botulinum toxin, is like a blockage of the message between the nerve and the muscle. So when we have this kind of expression, after the toxin, we cannot do that expression anymore. And the effect lasts for 4 to 6 months. So it is for improving the dynamic line. Dynamic lines such as Dr. Xia has demonstrated, we have the forehead line, the frown line, the crow's feet, and those, yes, the bunny line and the mental crease, yes, the DAO. Also, all are the dynamic line. So toxin basically is to smoothen out this kind of line and make us cannot do this expression when we want to express this expression.
Great.
So it's basically, yes, very long explanation.
No, that's very important because you are aware that how many people come through your doors who are not aware of this basic difference, and you have to explain them from the basic. And I'm sure that this is going to be quite informative for a lot of people. So where does thread lift come into play? If you say that I can put filler and lift, then why do we need threads?
For Asian, especially for Asian faces, we have thicker skin and thicker subcutaneous fat. We lost fat on mainly on the upper face and also some on the lower face, but lower part of the face actually will not losing much, but we will gaining fat. The fat layer will increase, and also because of the sagging, that the fold and the jowl will become more severe when we age. So lifting, thread lifting, especially thread lifting, is more towards the lower half of the face for Asian, and in my opinion. Right. And the effect will be most for the lifting of the lower face. When client come to my clinic, I usually will divide thread lift into 3 parts. So most common area is the jowl. So most of them will do the jowl lifting by thread. Second most common is the nasolabial for the mid-cheek lifting. And the third most common is the double chin and the jawline. So 3 part basically is the lower half of the face. And this part we gained the we are more fatty to start from, and when we age we lost volume here, so there will be sagging of the jowl, and thirdly the jowl itself will gain increase in volume. So basically thread lift will be the lower third, and the volume replenish will be mainly the upper, and also the facial contouring.
Dr. May, I would like to ask you that, do you do much of masseter slimming or the jawline slimming? Because you're actually sitting in the hub of the Asian market. And it's a very, very popular treatment with the Asians to slim the jawline. Can you tell me that is that done with botulinum toxin or threads or fillers?
This is a very good question, and is a very basic question in our population. Actually, for clients that they accept aesthetic treatment, most of them will be doing the masseter toxin as their first treatment. First, for ever treatment they have received, usually will be the toxin for the masseter muscle. Why? Because for our population, we have the broad face and the square face, and we have stronger, larger masseter muscle, the larger volume, and especially in Hong Kong, we are living in a very high pressure working environment, and people, not only ladies, male clients, they will come because they have the dentist will refer them to us because they have the dental problem. They have this biting habit at nighttime, and then make the masseter muscle very, very, very big. And also this habit is because of the working pressure, or also all kind of pressure from life. It will make it stronger, and also the eating habit. But we are stronger to start from. So for the masseter muscle and toxin, why we can use toxin to slim down the masseter muscle? Because it's like relaxing the masseter muscle when we doing the eating and chewing. After 3 to 4 weeks later, it will be not using as frequently as before, and then it will slim down gradually. And the effect is will last same as the other area. The effect will last for 4 to 6 months. So basically, mostly their first initial treatment will be the toxin, and then they are very well accepted. And it is a very quick procedure. It only takes a few minutes. And but your question is, when will I do the thread lifting or the toxin for the masseter, or will I do some lipo reduction on the cheek, the chubby cheek? It depends on the facial features and the individual assessment. But as a very rough guideline, for our Asian faces, we usually have all of the problems. So we usually have the strong muscle and some saggy jowl and some chubby cheek, right? So most of us have all three problems. So we cannot solve the one problem with only one toxin. So usually it's a combination procedure.
I agree with that, Dr. May, but I also feel that it's not just the Asian face. I think every face in the world has those three basic problems. They do vary when it comes to ethnic variations, but we'll talk about that. But I just wanted to ask you that if we do botulinum toxin to slim the lower third of the face, how often do we need this treatment?
Actually, it's also 4 to 6 months, but I would recommend my client to come frequently for the initial 2 years. Why? Because if you receive the treatment on the toxin on the masseter muscle, and then you visit me again 1 year later, the masseter muscle will slim down for the initial 3 months, and then gradually going back again for the later 3 months, and then 6 months later it will be just as before, right? But if the client visit me more frequently in the first 2 years, maybe she visit me every 3 to 4 months, then every 3 to 4 months it will be the maximum effect of the that toxin, that session, right? So that will be a cumulative effect. And the very big muscle will gradually slim down, and then finally we may able to achieve the effect that is so slim that we can see the angle of jaw. Okay. So this is our ultimate. And secondly, why I ask the patient to come frequently, because this kind of muscle is like a big the motor muscle that we train up, right? We train up in the gym. We train up the bicep and tricep and the abdominal muscle. So when we train up more frequently, the muscle will become bulky. The toxin, botulinum toxin, is the opposite of this effect. So we do not allow the muscle to use, and then we stop it from using for a very continuously period of time, up to 1 to 2 years, so it can achieve a semi-atrophy status. Right. So afterward, maybe after 2 years, the patient okay, no need to come so frequent. So they may come or every half year or every 1 year, or they will never come again for the toxin. So the muscle of the masseter will gradually go back again, but usually they will not go back to the original status, because the initial 2 years already have such a long period of resting. So the muscle become semi-atrophy. So so there's also studied from Korea that they study, and then they follow up cases that receive toxin and then stop receiving for 4 to 5 years, and then the effect can still partially maintained. So this, as a result, this is contouring, the change of the contour of the face. So I
Right.
think it's kind of
Talking about body contouring, you mentioned that, I understand that if we can relax a big muscle in the face to the point where it becomes shrunken enough that it gives us a slimming, is there a possibility that we can use the same botulinum toxin in other big muscles of the body to shrink them?
yes, actually, for the toxin in the calf area, we are using quite a lot in Asia because the leg, we don't have much subcutaneous fat. It's not like the thigh of the lower limbs. Thighs, we have a lot of fat, and if we want to reduce to become slimmer legs, we usually will perform liposuction or non-surgical device, right? But for the leg, most of the problem is because of the muscle, the gastrocnemius muscle, and also because of the muscle is not that only that bulky, but also the shape is not desirable in Asia, in Asian opinion, because our opinion of beauty of the lower limbs is more slim and more straight line and less muscular in nature. So especially for female, but maybe the trend is becoming not valid anymore because now we are promoting the healthy and more muscular body shape. So it's always changing. But before, like past 10 years, we are more pursue of the very slim and very straight line of the leg. So botulinum toxin of the gastrocnemius muscle, of the calf muscle, the medial part of the calf. So it mostly will make the muscle, the bulky muscle, slim down. So the lady will be very happy to wear dress or shorts, and then they can show off with their slim legs. And in the winter, they may say that they can wear boots because before the calf is too thick that they cannot sit on the boots. So for the calf, the lower leg is very popular. And for the recent few years, beside the lower leg, we also have the shoulder, the trapezius muscle. And this is called the slimming shoulder needle, direct translation from Chinese. So because the ladies are wearing spaghetti strap or the top that will show off the neck and the shoulder line, and then they want it to be more slimmer in the contour. So we also will apply this, but it's like a trend. So it become popular for maybe a few years, and now it goes down again.
Right.
And also we can do the calf, the upper arm, but not very frequent. The upper arm, the bicep, and the tricep and the deltoid sometimes we'll do, just to tone down the muscular contour.
It's so interesting that people are just aware that you can use botulinum toxin to get rid of that number 11, but it can do so much. This treatment of the traps with botulinum toxin is so popular, and not just with the Asian community here in Australia, but generally it's becoming very popular as well. But my question is, which may sound stupid to you, but because botulinum toxin relaxes the muscle and it weakens it. So if I get my calves treated, do you think that I will have any weakness in my legs while I walk? Or if I get my traps treated with botulinum toxin, will this weaken my ability to lift heavy weight?
Yes, I think that will be partially affected, but most of the effect will be temporary. So usually for the first few weeks, usually 2 to 3 weeks, client will experience some weakness on the treated area. For example, if we treat the shoulder and trapezius, we may have some weakness over this kind of movement.
Shrugging.
If we treat the upper arm, sometimes we will have the heavy lifting of the arms that will be difficult. But usually after 2 to 3 weeks, body will adapt, and then the toxin will diffuse, and then the effect will be gradually gone. So usually after 2 to 3 weeks, the client will not complain of this kind of weakness anymore. So usually it's the initial period. So for the lower leg, I would recommend client to not to have the exercise or high heel, wearing high heel or chasing bus for the first 2 to 3 weeks, just to avoid any accident.
So I think what I gather is that if it is just before 2 months, as we go into summers, it's time to visit Dr. May's clinic to get everything shrunken, to have a beautiful slim neck, to have beautiful slim lower legs. That is great. I think that I just feel that botulinum toxin has a great role to play in summer season, because is it true that botulinum toxin can also be used to reduce excessive sweating under the arms, Dr. May?
Yes, yes. This is actually a FDA approved indication for the medication for this botulinum toxin. So we can use to reduce sweating on the palm and the sole of the feet and underarm area, and sometimes maybe the forehead. If the patient has the sweaty forehead, sometimes we can use. So the effect can last for around 6 months, but because the sweating problem usually will be more severe during summer, right? Yes. So usually client will come before summer and then do an injection, and then they can last until September or autumn, and then wintertime they are fine. So usually they will come once a year before summer, and then they can do underarm, hand or feet as I mentioned.
Right. Thank you for that. Dr. May, in your clinic, what is the percentage of your patients who are Asians, and do you see any other ethnic population in Hong Kong as well?
Yes, I see, but majority are Chinese. I think 80 to 85% are Chinese, and then other are Caucasian. I have some friends related or patient refer patient. So I have some Italian and some French, and some most of them are expatriates in Hong Kong.
What is the difference between how would you differentiate an Asian face and a Caucasian face when you have to treat?
Okay, so maybe I divide for the botulinum toxin and filler, right? So it's two category. For botulinum toxin, basically is same, because we have the same distribution of muscle of the dynamic muscle, but dosage is a little bit different. For Asian, we have a little bit smaller dynamic muscle in general. So the dosage I use can be less. So for Asian patient can be cheaper, but I charge the same. So they're actually they are paying more for the same result. But for Caucasian, they're paying less, and but their muscle is usually is more strong, wider, and bigger, both female and male. So I'll need to use more unit to achieve the same effect of the botulinum toxin. And secondly, Caucasian usually in the past, they prefer a very freeze look. So they prefer no expression or nearly no expression after the toxin treatment. But for Asian, we are very afraid of this frozen look. So because we don't want this frozen look, so the dosage also will be much less than Caucasian. So this is the main difference. So for filler is a very broad topic, as I mentioned, because the facial contour is very different, and the skin texture is different, and the thickness of the skin and the thickness of the subcutaneous fat is also different. But in general speaking, our face is broader and flat. So we have flat nose, flat face, broad zygoma, and then square face, right? For Caucasian, the face is much smaller, and then the contour is much prominent. So for Caucasian, mainly the problem is the lack of support of the cheekbone, and also the sagging of the nasolabial fold and the jaw and the teardrop, and also because the skin is very thin. So in the early age, they start to have lots of wrinkle, and those wrinkles may not be improved by only botulinum toxin. So usually after the toxin, I'll need filler under the area to improve the very severe the skin fold and the lines. So it is also the difference between the Asian and Caucasian.
So how